We know that good women often have to make difficult decisions in life. To decide to bring a child into the world is one of the most important decisions you will make. At Northland Family Planning, we promise to treat you with dignity, respect, and compassionate caring for your heart. For the next few minutes, I'm going to talk with you about the first trimester abortion procedure, what you may experience both physically and emotionally, and possible risks and complications. The Northland team is comprised of caring, dedicated professionals committed to providing the quality abortion care you deserve. If you're between 14 and 17 weeks, you will be having a procedure called a one-day D&E. Your procedure is going to be a little different. When you meet with your counselor, she will go over all of your special instructions, consent forms, and answer your questions one-on-one. In the lab, we will measure your vital signs, run a pregnancy test, and do a simple finger stick to determine your Rh blood factor and hemoglobin. Depending on your medical history, additional testing may be necessary. An ultrasound is a way to determine an approximate length of pregnancy. The ultrasound may be done one of two ways. If you are early into the pregnancy, we will perform a transvaginal ultrasound. If you are further into the pregnancy, the ultrasound will be performed on your abdomen. Both methods are painless and take only moments to complete. Before your abortion, you will have time with one of our counselors. Not only will she be reviewing the information in your chart and answering any questions you may have, she will also help you with an emotional check-in. We call this our head and heart counseling. We want to be sure you feel your head and your heart are connected. If you have any uncertainty or ambivalence about your decision, it is important to address that before your abortion. We promise to care for you like we would our sisters, our daughters, like we would care for family. One of the biggest concerns that women tell us about is pain. When you meet with your counselor, you will discuss with her the different pain medication options that are available for you. Our highest priority is to make you feel safe and comfortable. We offer 2 different types of IV sedation, both included in your fee, to help you during your surgery. For your safety, you must have a ride home in order to receive any of our sedation options. The first option is the light IV sedation for pain relief. We call the second option our comfort medication, which is a moderate IV sedation. Patients concerned about pain prefer this option at no additional charge. It is made up of 2 medications, a twilight anesthetic and a pain reliever. The doctor may adjust the combination of these 2 medications based on factors such as weight, height, and tolerance to pain to help you feel relaxed, calm, and comfortable during your procedure. When all your steps are complete, you will be ready to see the physician. They will go over some information with you and ask you to sign an additional consent form as required by the state of Michigan law. A team member will be present with you to help you feel comfortable. A pelvic exam, which the physician performs as an additional method to confirm length of pregnancy, will be performed. Once the exam is complete, the physician will administer by injection the IV sedation you chose, which will take effect immediately. The procedure will start with the physician inserting a speculum into the vagina to open the vaginal walls. A betadine wash is used to clean the area, and a numbing medication will be given through an injection into your cervix. This injection takes only seconds and is usually painless. The tip of the dilator is then inserted into the cervical opening. This process stretches and opens the cervix further and takes approximately 30 to 40 seconds to complete. The dilation of the cervix may cause slight to heavy cramping. Nice, slow, deep breathing with our team member will help keep you focused. The physician will then complete the abortion surgery, which may be done one of two ways. If you are early into pregnancy, the physician will probably use a manual I-pass syringe. This technique will make the abortion gentler and is very quiet. If you are further into the pregnancy or unable to have the I-pass, you will have a standard suction aspiration. When you hear the noise of the machine turn on, you know that your abortion is almost done. After the abortion is complete, you will be taken into the recovery room. The physician will do an examination of the pregnancy tissue before seeing the next patient. This will help us know that adequate pregnancy tissue was obtained. If we believe that sufficient tissue was not obtained, a team member will discuss with you the possibilities for treatment. In the recovery area, your vitals and bleeding will be monitored. You will lie down for approximately 30 to 45 minutes, and then you can sit up for approximately 15 minutes so we can repeat your vital signs before you go. Abortion is one of the safest procedures performed in the United States, but as with any procedure, there are possible risks and complications. We want to make sure you know what these are because we believe in full informed consent and truthful explanation. Possible risks and complications are not malpractice, but problems we know could happen, even in the hands of the most experienced and skilled physician. Complications could include perforation or tear of the uterine wall and nearby organs, uterine infection, hemorrhage, which means excessive bleeding, rare allergic or adverse reaction to anesthetic or other medications, which include fainting, shock, convulsions, cardiac arrest, brain damage, or death. Rare possibility of death. Internal injuries or injury to the bowel or bladder. Missed or incomplete abortion, which means the pregnancy may remain, or tissue or clots are still in your uterus. Some complications can be treated by a repeat suction procedure, additional medications, hospitalization, blood transfusion, and/or additional surgery. In rare but possible situations, permanent disability and/or permanent sterility, hysterectomy, may result. An ectopic pregnancy is a pre-existing medical condition and is not a complication from or because of an abortion. An ectopic pregnancy is life-threatening and needs immediate treatment and/or hospitalization. You will be given a written handout titled Recovery at Home. Keep this booklet. It has all of your home care instructions and the toll-free emergency number in it. Please let us know if you have any questions before you leave today. For those of you who do better with verbal instructions, you can find a video on our website with home care information for after your procedure. If you are having trouble understanding or reading anything in your printed materials, especially your home care, please ask a staff member. We want to make sure you know how to take good care of yourself. Here is some additional information for you to remember. Your period should start in approximately 4 to 6 weeks. If you have not started a period in 8 weeks, call us, even if you have been released from our care. If you have any problems after your abortion and it is during business hours, call the center you were seen at. If you have an emergency and it is after business hours, call the toll-free emergency number printed in your home care booklet. All of us at Northland are concerned about your emotional health after your abortion. We encourage our patients to talk to people they trust, their family, friends, clergy, and significant others, to form a support system and share their feelings. There is not one way of living a good life, and sometimes we have to make really hard choices. Hard choices do not make us bad people. You are a good woman doing the best you can in your situation. Call us if you are having a difficult time with your emotional healing process. We have great resources we can share with you. Your home care packet has information on emotional healing, and our website has the same great resources under the Emotions After an Abortion and Resources and Links pages. We hope you will remember this decision as a time when you were strong and sure of yourself. If you are finished with your paperwork, please stop at the front desk when you exit the room and hand it to a team member. If you still need time to finish paperwork, please exit and return to the waiting room.